Hello everyone, thank you for joining us again on our Zido platforms as we continue profiling business people who are making a difference in Zimbabwe. And this is the aftermath of the Homecoming and Business Summit. Today we are all the way in Norton at Galloway Medical Centre. I'm joined here by the founder and CEO, Mr. Neya. Thank you for having us here.
Thank you so much.
So let's start off with Galloway Medical Centre. When was it established and how did the idea come about, really?
Okay, so the idea started off when we're still out of the country, but opening the doors was the 12th of September 2024. So the idea actually started off around December 2023. That's when we started making concrete steps towards establishing the hospital, Galloway Medical Centre. How it came about, the question that people always then ask is why Norton?
Right.
Yeah. Why not Harare? Why not the big towns? So what we had actually noticed was that there was a huge gap in terms of the quality of care provided, especially in the smaller towns. We're looking at Norton, which is just maybe less than 40 kilometers from Harare. But then for most of the patients, for them to access quality care, it meant driving all the way to Harare. If you've got your relative admitted, it means that every day you have to drive all the way to Harare, and sometimes there are 2 visiting hours. You then have to spend some time in between. So what we tried to do is then the idea was that let's put this thing in Norton, give people a quality healthcare service closer to home, and try to also not just a hospital, make it a specialist hospital with specialist cover. Be it physicians, pediatricians. We are proud that we are actually probably the first center which actually managed to bring in different medical specialists to Norton. So basically removing this for the need for people going all the way to Harare. Sometimes someone has got an emergency, and Blawa Road sometimes tends to be clogged up. So you reduce the time between what we call the golden hour in medicine, where we are closer, and if an emergency arises, we're able to take care of it closer to home before someone starts thinking about I need to go to Harare.
Right.
Yeah. So outdoors we did our official opening ceremony on the 12th of September 2024, and it's now been maybe 16 and a half months operating, and we are enjoying it, and we've made I would say that we have made a bit of impact in Norton as well, and I think people generally are happy.
Right.
Yeah.
I mean, why would they not be happy when you're fixing such a big problem like that? But I want to come now to the process of starting a medical center. When we speak of starting businesses here, they're like the big industries, mining, agriculture, we're talking the retail sector. But it's very rare when someone comes and says, I want to start a hospital. How was the process like for you?
The process just had a couple of challenges. Having been out of the country as the medical doctor, I had to re-register with the council, the medical council. And then, after that, we started, setting up everything. But then there are a number of licenses that you need for you to operate legally. So we then had to go through, the Norton, getting the approvals from the Norton Town Council. And then once that one was done, we had to get our business licenses, obviously the usual company registration, but specifically for the hospital, we had to then go through the medical council inspections, getting the approval to open up the hospital, and as well the Youth Professions Authority. So that's only after that did we get the license to officially open. The only other thing which then we had to do afterwards was also to apply to what's called AFOS, which is Association for Youth Care Funders, for us to be able to start taking medical aids. So again, it was another process which needed inspections as well, and then we graded, and then only then did we then start taking medical aids.
Now, a lot of business people would say that the process of getting these approvals seems a bit cumbersome, a bit too cumbersome, if I should say. Would you agree with that sentiment? And if there's anything that you would change, what would it be specifically?
I would say, if we could get some of these licenses be done, or because as a hospital you need the inspections. It's not just applying for a license. So there has to be a physical inspection of the operating space, whether it's meeting the quality and the standards which are required. So what takes long establishing a hospital is obviously, we have to do one license before you apply for the next. So, and it's also a bit pricey. So we find that if I were to change one thing, it will be that, if we can have most of these inspections being done as one inspection. Yes, there might be different inspection bodies, but then we just have one inspection day, because at the end of the day, it's a matter of establishing everything, putting up all the equipment, doing necessary renovations if there's need to do necessary renovations. And then when you're done, you then start the process of registration, which might take months before you actually get the approval to open. So the one thing that I'll change is if we can get all of these inspections being done all at once, so that it doesn't end up taking longer before you actually open the doors to patients.
I know when we were speaking off camera, you mentioned wanting to bring a piece of the diaspora back home.
Yes.
And I'm keen to find out from you what is some of the things that you feel Galloway Medical Centre has that is an advantage over other medical centres in Zimbabwe.
Okay, I think I had the advantage of working here locally before I left and then came back. One of the things that we realized, or I realized, was mostly to do with, sometimes the private sector, we tend to look at a patient as a business. But what we have been striving to do is to make sure that the hospital, it feels like a home away from home. Patients don't need to feel like they are in a hospital. They need to feel like they are at home even though they are sick. Be very comfortable and try to bring that personalized touch to patient care, so that we don't just look at a patient as just a patient. One of the things that we've always tried to do is to make sure that a patient, we strive by all means to take care of a patient the way that you also want your own mom to be taken care of, or your dad to be taken care of, or your wife to be taken care of when they are in a hospital. Comfort is one thing that we've always strived to do, and always make sure that our patients are very comfortable, with obviously a hope that when they come in, they walk out of the hospital happy, and having that personalized touch, which is also the follow up when the patients are home, is actually very important. So because the care sometimes should not just be about once the patient is coming, but what is it that happens when they are now at home. So it's that which we've been trying to introduce and also get our patients to actually feel like they are part of Galloway, and what they want is what we try to strive to make sure that we give what is best for them.
Now, you were obviously part of our last event that we had this past December, the Homecoming and Business Summit. How important was it for you as Galloway Medical Centre to be part of the discussion?
For us, it was something that it was our first time to actually attend, but one of the take-home messages which we got, besides the interactions that we then had with everyone else who was there, is also to see that there's a lot of people who are actually doing well in the country. People who have been in the diaspora, who have actually decided to come back and invest. When we made the decision to come back, you hear a lot of things. People will tell you a lot of things. It doesn't work. Don't go. But then, we have gone through. This is January. We're looking now at about almost 17 months operating. Yes, we have had our challenges, but we have not been we have managed to. To overcome most of those challenges, and being part of the awards actually showed us that we're not just the only ones. There's also a number of people who have come back and are doing very well in the country. When you're out there, sometimes you end up just focusing on the negative, but then sometimes you also have to think about what is it that I can do for my own country and for my own people. So. Being there, it was very important for us to know what else people are doing. And also from a business point of view, we also had a lot of interactions with other companies, and for business it was also quite good. It was also good for us to also market the place. So it was worthwhile attending those awards and being part of them. So as patients come in, so what we operate is an ER plus a hospital.
All right.
So as patients come in, they come in here, they're served by the reception. For emergencies, they pass through the dedicated or go straight for the emergency side. So this side is the emergency room, that's where the consultation rooms are as well. So we've got the admissions, adult admissions, as pediatric admissions that side. I think we can start with the adult admissions.
Adults, right. So what's your staff like? How many people do you have employed?
So far, we've got about 16 permanently. So we've got the adult male ward.
Very clean, very cozy.
Like I said, we just try to make it a bit, comfortable for the patients, and then if you can come through this side. So this side is for the private admissions.
All right.
This is one of the private rooms. For those ones who just want to have their own private space. So that's where they come in.
Oh, they even have a couch in the fridge.
They even have a couch in the fridge. we're
That
just
was
trying
like
to
home
make
away
it,
from home.
yeah,
Yes.
home away from home, and they need to feel very comfortable
Right.
being in the place. We just wanted them to feel more like they're in a hotel.
Do you have any expansion plans? We would
Yes,
want
we do.
something like this in Harare as well.
Yeah, something will come up. Unfortunately, we've got some patients that
Alright.
so, yeah.
That's fine.
You want something like this in Harare?
We need it
something
as
will
well.
come up.
So these are just
So these are just the
bathrooms.
bathrooms, and then just past the consultation rooms.
Alright.
Yeah, and then for most of the emergencies, they go straight into the resuscitation room. And then, so this area is just one of those areas that
Where visitors can just come in.
Just be, people are so used to hospitals. When you go to hospital, you sit on those
On a
airport
bench.
benches. Like I said,
Right.
we wanted our patients to feel, the patient has to be comfortable. The relatives also have to be very comfortable. So it's just a place for them to sit.
Yeah.
Yeah, and obviously
This is the children's ward.
children's ward. Yeah. So it's just a children's ward, but we also, with kids, you want kids to be able to play.
Right.
And so what we tried to create was an open space for them to be able to play, interact, and they have space to actually,
Yeah.
which, like I said again, allows them to feel like they're not in a hospital, yet they're actually undergoing treatment. Yeah.
Quite nice. So what else can we expect from Galloway Medical Centre? Are we bringing any specialist services?
Yes, we already have got specialist services, which are already covering the hospital. Like I said, we've got one of the, probably the first people to bring in specialists to Norton. So we've got general surgeons who cover the hospital, we've got physicians who cover the hospital, pediatricians as well. So we've got that whole area of cover for the hospital.
All right, so Galloway Medical Centre was given an Excellence in Health Service Award. How do you feel about it?
I was so excited and happy. We feel like it's something that we didn't expect it.
Yeah.
When you're just doing your own work, you just think, it's just something small. You don't even know the impact that you're doing. Yeah. So we're very happy about it.
All right, well, congratulations. I think for some of those that were present at the award ceremony, they didn't get a chance to see what Galloway Medical Centre actually does. And I think this video has done justice to profiling the work that you're doing. And of course, as Zido would like to say congratulations to you and thank you for the good work that you're doing.
Thank you so much.
Yeah. As I said earlier, we want to see more.
No, I think
we want to
definitely
see more of you in different
things
towns.
things are coming up. Definitely.
Right.
Yeah. Just a matter of time. But more things are coming up. I think this year will be an exciting year for us.
It should be. It should be. Your closing remarks to those that are in the diaspora who may be skeptical to come back home and start a business.
Okay, so I would say, you don't listen to the negative side of things. There is a lot of opportunities. You just have to have an open mind. And sometimes stop listening. Don't listen to the noise which surrounds. You can only do what you can do for you, yourself, and your community. And just strive to do the best that you can, and it will always work out.
All right. Well, thank you for your time and for allowing us in your space. And to those that are following us, or maybe if you're not, please do Zido on Instagram, ZIDO. We are Zimbabweans in the Diaspora organization on Facebook and on LinkedIn, so you can get a bit more insight as to the work that Zimbabweans are doing, not just in Zimbabwe, but also in the diaspora and the impact that they're making. I am Nicole Jam, and I hope you join us again on the next video as we get to profile more of these people that are making a difference in our communities.